Pros and cons of different contraceptives. Hormonal implants. Pros. Long-term method of birth control protects against pregnancy from 24 hours to 3 years after insertion, can remove whenever you want to, or can wait until time for a change of implant. Very effective against pregnancy. May cause slight or no menstrual period. Cons. Requires minor surgery and insertion of the tiny rod underneath the skin. Requires minor surgery to remove device. Can cause side effects such as irregular menstrual periods, depression, nervousness, hair loss, and weight gain. Intrauterine devices. Pros. Very effective against pregnancy. Provide protection against pregnancy as long as in place in your uterus. Protects as soon as inserted, so don't need to remember to use contraception if you have sexual intercourse. Doesn't need daily attention, just need to check to make sure in place at least once a month at time of menstrual period. Cons. Need to be inserted by a healthcare provider. Can fall out or can rarely puncture the uterus. The copper IUD can have side effects such as menstrual cramping, longer and or heavier menstrual periods, and spotting between menstrual periods. Slightly higher risk for infection in the first 20 days after insertion. Tubal ligation. Pros. Very effective against pregnancy. One-time decision that will provide protection against pregnancy forever. Cons. Need to have minor surgery. Permanent. Although it is possible to undo sterilization with major surgery, it's not always successful. Only should be used by women who are absolutely sure that they do not want any or more children. Depo-Provera hormonal injection. Pros. Each injection provides 3 months of protection against pregnancy. Very effective against pregnancy if used correctly. Many women stop getting their menstrual period while getting injections. This is not a medical problem, and menstrual periods usually return 6 to 18 months after you stop taking injections. Help protects against uterine cancer. Cons. Need to see your health care provider every 3 months for an injection. Depending on your insurance, your birth control may be free or there may be a copay. May have side effects such as weight gain, tiredness, and possibly a decrease in bone density. Birth control pills. Pros. Very effective against pregnancy if used correctly. Makes menstrual periods more irregular and lighter. Decreased menstrual cramps and acne. Makes you less likely to get ovarian and uterine cancer, pelvic, inflammatory disease, ovarian cyst, and anemia. Cons. Depending on your insurance, your birth control may be free or there may be a copay. Need to remember to take every day at the same time. Can't be used by women with certain medical problems or by women taking certain medication. Can occasionally cause side effects such as nausea, increased appetite, headaches, and very rarely blood. Hormones patches, PRONs. Very effective against pregnancy if used correctly. Makes menstrual periods more regular and lighter. Decreases menstrual cramps and acne. Makes you less likely to get ovarian and uterine cancer, pelvic inflammatory disease, ovarian cyst, and anemia. Cons. Still need condoms to lower the risk of STIs. Can't be used by women with certain medical problems or by women taking certain medications. Can occasionally cause side effects such as nausea, increased appetite, headaches, and irregular bleeding in the first few cycles. Higher risk of blood clots. Vaginal hormonal ring. Pros. Very effective against pregnancy if used correctly. Makes menstrual periods more regular and lighter. Decreases menstrual cramps and acne. Makes you less likely to get ovarian and uterine cancer, pelvic inflammatory disease, ovarian cyst, anemia. Cons. Still need condoms to lower the risk of STIs. Can't be used by women with certain medical problems or by women taking certain medications. Can occasionally cause side effects such as nausea, increased appetite, headaches, higher risk of blood. Cervical cap. Pros. Can insert several hours before sexual intercourse. Can live in a place 24 to 48 hours. Will give protected sex for up to 48 hours. Use less spermicide with the cup than with the diaphragm. No need to apply more spermicide with each act of intercourse. Cons. Need to be fitted by a healthcare provider and need a prescription. Limited sizes available. Can take out until 6 to 8 hours after intercourse. May get moved out of place. Some women may be allergic to material of cup or to spermicide. Can't be used by women with a history of abnormal pap test. Male condom. Contraceptives. Conce- Contraception that provides the most protection against sexually transmitted infection. Latex condoms are best. Don't cost much, 50 cents each. Can buy at almost any drugstore. Don't need a prescription. Men feel they can last longer when using a condom. Cons. Have to use a new one every time you have sexual intercourse. Can only be used once. May interrupt sexual activity as it needs to be put on just before penetration. Can break. Women may be allergic to latex. Withdrawal. Natural. So no side effects. Doesn't cost anything. Allows men to be an active part of preventing pregnancy. Not very effective method of contraception. Difficult for male to always predict ejaculation. May decrease sexual pleasure of woman since need to always be thinking about what is happening during sexual intercourse.